All right. Morning, Kandel. So I would recommend that we get started now as people are joining the Zoom call. And to everyone in the Zoom room, welcome. And to those persons watching on social media, also a welcome. So, Kandel, I think you can advance the slide there now. And we'll get started with the introduction of host and guest speaker. The next slide, please. Right. So this morning, I'm pleased to be your host. I'm Dr. Vishnu Durga. I'm the chairman of Action Invest Caribbean Inc. And I'm hosting today in collaboration with the Global Compliance Service. Uh, it's very important, in my opinion, that our organizations in Guyana really step up their game, because if we are to compete globally, we need to have organizations that meet their respective global standards. And the globe is coming to Guyana, which means that international companies which have been used to operating at global standards will be entering our country, our economy. And in order for us to have a very smooth transition with those companies, a smooth integration as well, for us to be able to work with them very smoothly, and more so for our organizations to provide a level of service to our Guyanese citizens, which I believe deserve a much higher level of service, better standards. Um, what we do need to do is to make sure that our organizations become certified, become standardized, so that persons can really depend on what they bring to the table. So I'll be acting as the host. I'll also be interacting during the question and answer segment. But I would now like to introduce your presenter today, Ms. Kandel Bostwick. And Kandel is going to tell us a little bit more about herself, but it's an absolute pleasure to be working along with Kandel. She has a ton of experience when it comes to standardization, and she's very passionate about the field. And that's one of the main reasons why we are providing full support. Kandel.
Good morning, Dr. Durga. Thank you for hosting this important webinar. And a special good morning to all of our viewers. Thank you for tuning in at this time. As Dr. Durga mentioned, at Global Compliance Service, we believe that it is very important that as a certification body, we keep you updated and abreast with what is happening. And Guyana is very privileged to have an ISO certification body in its presence, where we can provide to you guidance on what is happening at the international level. And today, our webinar is focused on providing us with some guidance that we can use as we may move towards reopening of our public facilities. I'm indeed happy to be your presenter today. And with my background, I believe that it's very important that we are aware of how we can approach the reopening of these facilities whenever that times come in a very systematic way, where it will promote the safety of all of us here in Guyana, and more so our children and the more vulnerable groups within our population. The outline of today's webinar, firstly, as you know, we'll be dealing with the COVID-19 pandemic, and it is one that is affecting us globally. And Guyana being part of the global village, we must also be prepared and continue to be at a level of readiness to face this pandemic as we are doing. So first, I'll provide you with a little background about COVID-19. I'm going to look at some of the key challenges and opportunities that this pandemic has brought to us. We're going to highlight some pre and post COVID norms, highlight the established guidelines for the reopening of public facilities, and then we're going to define the certification process that as a certification body, we can provide to you to facilitate public confidence that when our facilities have been reopened, that they are safe for us and our loved ones. So firstly, what is COVID-19? And I know by now, all of us know what COVID-19 is. But I think from time to time, we need a reminder. So we need an infectious disease, and it's caused by a newly discovered coronavirus. And we know that it is contagious. So that is something we need to bear in mind. The coronavirus is contagious, and it is spread primarily through saliva and discharge from our mouths. So when we have an infected person in our midst, there is a high possibility that we can contract it. And it is not a disease that you can just look at someone to know if they have it or not. So we have to be protected at all times. So it is said that when we cough, if we do not practice good hygiene by covering our mouths, right? It can go to the surfaces that are around us. For example, if there is cardboard in our midst, it can stay there for as long as 24 hours. So anyone else going to touch that piece of cardboard, maybe a cardboard box, right, may become infected unknowingly because they did not know it was contaminated. Because remember, viruses are so more tiny, you cannot see it. It may land on stainless steel, right? And it can be there for a few days, and also on plastics. And these are some of the items we may find in our schools and in our churches and other public facilities. So that is why we're encouraging persons to be aware of how this infection can be spread. And I'm sure most of us are following the global news, and we're seeing every day how the disease is being spread. And there's some of the very common symptoms that we can look for, and some that are very severe. So, for example, the most common symptoms would be fever, dry cough, and tiredness. And we've also been told that there are some persons who can be asymptomatic. That is, they will show no signs. However, this disease can become very serious when there is difficulty in breathing, and if there is chest pain or loss of speech. And based on the WHO illustration, it shows us in this picture here the percentage of the population that may have these different symptoms. And as we know, it will vary from country to country. And also it can vary from human being to human being because we are all different and we all react differently to viruses or any other disease that our bodies may be in contact with or exposed to. Now, the period of infection can be an average of 5 to 6 days. However, symptoms can show up within 14 days. And that is one of the reasons why you will hear about a 14-day quarantine period. Because over that period, you're monitored to verify whether you have the symptom or not, right? And if you require treatment, whether you're positive or whether you're negative. So, all of these things I would like us to bear in mind as we proceed through the presentation. How can the COVID 19 be transmitted? And this is another key area we need to pay attention to, especially when we're thinking about our children and the elderly or the most vulnerable in our society. Touching of contaminated objects, as I mentioned earlier. And if you touch the items and then you touch your eyes, your nose, or your mouth, you can be infected. Also, if you're standing too close to persons, for example, if you're closer than a meter from someone and they breathe, if they are infected, the droplets from their nose can infect you. You can breathe in those droplets. So the distance is very important. That is why our Ministry of Public Health, for example, has been advocating for social distancing. About 2 arms length away is a safe distance to be from someone. And also the use of the mask, the face mask, which has been seen to be a good barrier. Okay? And why it's so important for us to be to take caution, it's because there is no treatment to date. May have treatment within another year or so, we do not know. But we know the scientists are working overtime to see how soon we can have an effective vaccine. So, in the meantime, we have to consider this virus as not being treated. Now, I'd like us to look at some of the challenges and opportunities that may have arisen due to COVID 19. And when I focus on the challenges, I would have basically looked at what we are accustomed to, the, 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 the norms in our society, right? So the first challenge, as I mentioned, is that there is no treatment. We have some individuals who are still not practicing social distancing, and we would hear it and we would see it every day, even when we go down to Georgetown, for example. We will see it. So while some persons are practicing social distancing, there's some of us who are not. Some individuals are still not complying with the use of face masks in public gatherings. Right? We still see that there are few persons walking around in busy areas without their face masks. Sometimes, in some cases, we may not have the hand washing facilities available, or if they're available, they may be inadequate. Sometimes they may not be equipped. And I know sometimes we would normally say in our slang, we want to stretch the dollar. And by stretching the dollar, some of us may go into the act of diluting hand washing liquid so that it can last longer. Now, when you dilute an hand washing liquid, it would not be as effective as it should be. Because remember, the manufacturers would have put a stated amount of ingredients that can kill or that have been proven to kill bacteria. So if you dilute those liquids, it will not be effective. So sometimes we may have been exposed to instances like that at some of our public facilities. Now, those were some of the challenges. Now, out of challenges, there are opportunities. And we can see some of the positive effects that COVID 19 has brought to us, especially in terms of our personal hygiene and the practice of respiratory hygiene. So there are some positives. A lot of us are eating more healthier foods. We're now conscious of using a lot of vitamins, a lot of fruits, a lot of vegetables, so that we can ensure that our immune system is strong. We even have persons who are practicing um, good personal hygiene or frequent hand washing. We could have seen installation of more sinks and so forth for hand washing in public areas, like for example, the Stabrook Market area as an example. And we're hopeful that treatment will be available within another 12 to 18 months. So a new vaccine will be developed. We can have training of our staff, training of children on personal and good hygiene. Sometimes there wasn't that much focus, and now there's an emphasis on that. And also, you can have now a process for validating that our public facilities are safe. Before, you would have taken a lot of things for granted, but now we are more conscious of our environment, and that's a positive. Now, who are our most vulnerable groups? And we've selected the children and the elderly for some of the reasons as we would have seen listed. As we know, some of our children, their immune system, because they're not adults as yet, will be still under development. Some of them may not even be eating healthy foods. I'm sure some of you can agree with me that when you go to parent teachers meetings, some of the teachers may be pleading with parents to ensure that their child brings a healthy lunch or a snack to school, right? And we have the elderly whose immune systems may be weakened because of age. And in most cases, they may have underlying conditions, which of course would weaken their systems and make them more susceptible. And of course, we can look at how they interact, right? So, for example, our children, and this is from preschool all the way up to secondary and probably even university. They like to play together, and playing involves touching, hugging, sharing. They may sneeze without covering their mouths. We have our classrooms, for example. An average class may be about 25 to 30 students, sometimes more, right? Have we thought about how are we going to look at social distancing with our children? And how are we going to limit social distancing within our classroom and also in their interaction? So the way in which we would have operated before, the way in which we would have been teaching, COVID-19 will have an impact on all of these things. The elderly, most times our elderly, when they're at home, many of them would be at church, involved in a lot of church activities. And we all would have had experience to church activities. There is interaction, there is hugging, there is, greeting and so forth. And also with the elderly, in some cases, some of them are looking at their grandchildren who are going to school. So the grandchildren may or may not be exposed and come and interact with them at home, right? They may not always have access to a balanced diet, and they may not also always not practice respiratory and personal hygiene. I'm sure those of us who would have had relations or associations with our elderly will know that these are some of the factors that we have to assist them in many cases. And I'm just showing you some scenes of interaction of our children just to bring the picture to us. So let us start to visualize when our schools reopen, some of the things that we will have to address or pay keen attention to, right? Pre and post COVID norms. These are some of the scenes before. Remember, we have assemblies in school. Our churches may be filled to capacity, especially at special services. Just imagine what will happen after COVID-19. Would we have this type of environment, or as we open during the period of COVID-19, if that time comes, when that time comes, right? We would not have to, but this is the type of interaction we would have been having before, right? And as I've mentioned before, we may not have access to the potent sanitizers, for example, in our schools and churches. We may even dilute disinfectants, well, I mentioned that before, and limited space. No social distancing in classrooms. Our classes probably used to be cleaned twice a day. Now we may have to clean more frequently, right? Limited or no training on good respiratory hygiene or hand washing. These things were just seen as oversights, right? But now we will have to pay special attention to them. For example, after the pandemic, or if we were to open anytime when we believe it's fit to open, we have to start sanitizing our surfaces more often, right? To ensure that they are not infected, that we're able to kill any viruses that may be on those surfaces. So we will have to ensure that our schools and churches are clean and hygienic. Promote regular hand washing. So we may have dispensers, right? And we could have the touchless ones, because if persons touch, if your fingers contaminated, you can contaminate the item. So this is just an illustration. The touch free, you have your hand sanitizers, right? And you have if you're hand washing, your soap liquid and your tissues to wipe your hand on, and then a bin to dispose of it. Also, we promote good respiratory hygiene in school by having posters up. You have training up, you have regular reminders, so that after a time it will become a new culture for us, right? So after this COVID period is up, or when we feel, or when Guyana feels it's the right time to open our schools and our church facilities, for example, or religious organizations and other public facilities, we have to take note of these precautionary measures to prevent the spread of COVID. For example, there will be briefings with the parents, teachers, and children about COVID-19. So we have to know what also happens in the family, because the child comes to school, you don't know from the environment, so they must be vigilant enough, open enough to say, okay, someone in my community was tested positive. Someone in my home is tested positive, or they have signs and symptoms, so they're on the quarantine. So there are certain measures now that we will have to put in place to ensure that it does not come into our environment. Testing of our temperature. And we've seen this happening in some of our public facilities. I've seen it at some stores and so forth, where we're testing the temperature. As you know, the body temperature is supposed to be 37 degrees. Above that may be considered, you're having some amount of fever, right? But at the same time, we need to ensure that we have a protocol in place for ensuring that those thermometers maintain their level of accuracy. And I specifically would have highlighted this particular image because it shows the error range and the degree of error. So persons using these thermometers must also recognize that there is a degree of error in your recording, and they must take that into consideration. That is, your thermometer must be calibrated. And then you have to know the frequency of calibration to make sure that it's accurate, so persons can have accurate readings. So we will have to have training on persons, for those persons who are using the thermometers, and what to do and how to use the level of error. So for example, the thermometer here has an error range, 32 to 35.9 degrees, means positive or negative 0.3 degrees Celsius. So that means its level of error is at the 0.3 degrees. right? So we must know how to apply that to the temperature reading by adding 0.32 or point or taking it away from the reading to ensure that you are in the range. So in terms of reopening, we believe that protocols should be established to ensure that our public facilities are safe, and that includes our schools and religious organizations and other public facilities. So we may have to go through the process of procuring the essential items, like I mentioned, your sanitizers, your hand soaps, your napkins, or whatever is necessary to ensure the environment that you're in are safe. Even if we receive donations, we must also ensure that they are going to help us in stopping the spread of COVID. And then we need to have the markings for where persons stand, where they can sit. So, for example, in the school, if you have assembly, your markings how you will stand, how you will sit. So you ensure there is a safe distance between each child when there is a public gathering. And also the implementation of effective sanitation and cleaning procedures, right? So these are the guidelines we're hoping will be in place to ensure that our facilities are safe. We must adapt to new changes in our social behavior. And we've already seen that, right? No handshakes, person are touching the elbow, for example. You don't cough in your hands, but in your elbow, right? And frequent hand washing. We'll have changes to the layout of our classrooms, changes to the layout of our churches to facilitate social distancing and to reduce the spread of COVID 19. So we have to start thinking along the lines as to what our classroom would look like. And then with our classroom, it will be okay. How will we get all those children taught? Because it may be half of the class in some cases when we finish the marking off. So we may have to go, for example, to a shift system, right? So we may have to use technology. For example, some schools have started to use Zoom technology and WhatsApp and so on, where you can continue to teach the children. We may have rotation of students attending classes in overcrowded schools, change in the delivery of content. So now it's an opportunity, for example, for us to have the smart classrooms, where the facilities, those children who have the facilities at home can tune into the classroom and they would have the same teachings as what is happening at school. Likewise, we have systems where we can rotate. Half of the class come in the morning, half come in the afternoon, right? So there are some changes that we can look at, right, to ensure that our school environment is safe. And these are just some examples. I have an example here from, I think it's Hong Kong, where the students now have the barricade around their desks. We have Zoom technology. We have the class with a spaced environment, right? Children having lunch, and you see they've spaced every other seat or maybe every two seats. And we have church where it can be spaced out. So these are just examples of what post COVID can look like to us. Now, how prepared is Guyana to reopen? Now, at Global Compliance Service, we do not know when our schools will be reopened, but we believe that it's a very opportune time for us to share with Guyana, with key stakeholders, how we can benefit you as a certification body to provide confidence in your facilities when you say, yes, we are ready to open schools. Yes, our churches are ready, our public parks are ready, they're equipped to ensure that everyone who enters is safe and they remain safe. And if anyone enters and they become ill, we have measures to take. to ensure that they receive the appropriate treatment in the shortest possible time. And I'm sure we'll all be happy with that. So, how confident are you in sending your children to school? If you hear next week, school will be reopened in July, how would you feel? Would you gladly send your children to school? What will give you that confidence that the school is safe for your children to go to? Have you thought about that? How do you know that the schools and the churches or the other recreational facilities have implemented the recommended guidelines? How do you know that? And we're going to answer those questions for you. They've implemented, how well are they following the guidelines? What are the protocols of public facilities? Do we know what are the established guidelines of public facilities? Do you know how to detect that a place is safe to enter? How do you know that the environment is safe? Is it telling that I'm doing it? Yes, I'm doing everything that the ministry says. Or do you want proof that it is being done? Which do you think is better? Me telling you that my school is safe, or I'm providing proof to you. Look, someone came and checked my facility, and they've said that I am following all the protocols, and as far as possible, I'm going to ensure that every child or every adult or every person who comes into this facility is safe. And we have measures in place to address those situations that may arise while they are in our environment. So, the only way that can happen is for us delivering confidence in our public places. And how can we do that? So, we're saying that the owners and management of public facilities must be able to prove certain things to us, that their facilities are safe to prevent the spread of COVID-19. And I'm sure those of us who are abreast of what is happening globally, we would have seen different measures in place for those countries or states, for example, in the United States of America, who have started to reopen their facilities, right? How do we know that these facilities are following the recognized protocols? So they must have some evidence to prove to us that they are doing what is required and they're doing what is sufficient to ensure that our place is safe. And that is why we are introducing to Guyana the third party validation process, or what we would call it certification. And certification really stems from the recognized body, in this case, Global Compliance Service, who's an accredited certification body. And we basically will check to ensure that the public facilities are following the protocols. So first of all, you may have some policies established. Of course, for example, you may have a policy established for hand washing for children. We wash hands every 2 hours. All the children in school have to wash their hands every 2 hours. We check the temperature of the children on entry to school. The temperature must be between X and Y range. If it's not, what do we do? So there are certain policies that will come up. And these policies and the regulations, of course, will come from our Ministry of Public Health. And also for those of us who may want to move ahead, we have the CDC guidelines, we have the WHO guidelines, which is seeing what is happening globally in different countries that we can start to adopt based on our resources. So when an independent body, that means a body who has no association with you, they don't help you in developing the system, they're independent of your operations, they come, they review your documentation, and they do an audit to ensure that what you say you're doing, you are doing it. And you have to have trained persons, trained auditors, and I mean quality system auditors, for example, who can come to verify that you are meeting the protocols, just like how we would do it with our other certification programs that we offer. So we anticipate that the government of Guyana, through the Ministry of Public Health, and we have the COVID-19 task force, right? We would like them to consider establishing protocols for the safe reopening of public places, right? And also for them to ensure that the management of these public facilities implement these protocols. And these protocols may vary based on the type of institution, the number of persons that are there, right? Now, after that is done, you will now have a validation process, which I spoke about with the certification. We will now have a validation process, which will verify conformance to the protocols, right? So that is where our third party certification comes into play, right? So we're basically validating that the public facilities are doing what they say is recommended. And when we do that third party verification, we call it third party because you're independent. It provides confidence that the public facilities are safe. It provides assurance to the public, including our parents, our teachers, and other stakeholders, that the protocols are followed. So you don't have to worry about if the school is safe, have they done enough? Because they will have a certificate posted in a very visible area where you can see that the facility was audited, right? Now, the validation process, quite simple, and it's a recognized process to provide assurance that our public facilities are safe. So, like certification, the facility compliance program is not mandatory, and it will be valid until the end of COVID because we will have to ensure that the protocols are maintained. So, in order for this validation process to work, we first need to establish the guidelines for Guyana. So, we need to know what are the guidelines for reopening of our schools and public facilities. Secondly, once those guidelines are available, you can start 8 steps to the facility compliance certification, which is what you will offer, right? So, firstly, we must have the guidelines established. Then our facilities will implement those guidelines. And then we can go through the process to do the certification. So, basically, the first step is for the client, who is the management of the school or the church or the ministry or whomever. They apply for that COVID-19 audit. We will review your application and prepare a proposal which is sent to the client for them to approve. Once that's approved, we would plan the audit and we do your document audit. So we check your policies, your procedures, and then we do the on-site audit. And then a decision will be made on certification. So if we audit and we find that you have not addressed key aspects of the policies or the protocols, we will then inform you, and then you do your corrective action and we do another visit. After you've been compliant with everything, we would issue a certificate which is valid for 12 months or 1 year. We'll conduct surveillance visits, that is, we'll visit the premises every 3 months to ensure that you are maintaining the system that you've implemented. And you can do a reapplication by the 9th month, so you can have a renewal for another year if that is required. So this process can take an average of about 5 days. And you can visit our website, gcsregistrar.com. Right? So the certificate that we will issue to you will have a unique identification number, which you can verify on our website. And I'll do a demonstration for you at the end of the presentation. So there will be no fake certificates. There'll be authentic certificates issued by the certification body. So anybody can go online and verify. Right? So we will keep you updated on any new requirements or new guidelines, so you will adjust your system. And implementing a system always calls for improvement. So you'll see how it works. You go through the cycle and then you improve so that you can get better. So we're basically proposing this model because as an internationally recognized certification body, we believe that we can provide our Guyanese population with a confidence and also to instill trust in them that our facilities are safe for reopening. And that is one of the reasons why we are bringing forth this proposal. So when that time comes for reopening, at least we have a system in place to provide confidence and provide assurance that our facilities are safe. So in summary, so facility compliance certificate will ensure that there is visibility that a facility has been verified as meeting all the guidelines required to prevent the spread of COVID, and it will provide public confidence. It will also demonstrate your commitment, right, to investing in your facilities to stop the spread of COVID. And it's a visual declaration issued by an authentic authority. And I think once we embrace this proposal, we will be able to curb the spread of COVID among our school children, as an example, because there are many other factors that we can speak about. But today, we'll just like to share with you what we have in place, and we look forward to your questions and your suggestions and the next stage. So I thank you again, and I'll hand you over to Dr. Durga. Any questions?
Thank you very much, Kandel, for that really explicit explanation of what COVID is all about and the importance for a third party to come in and provide that level of certification. I'm sure that many organizations are already putting things in place to really safeguard the public, safeguard their team. But it is very similar to, in my opinion, to ISO, where organizations can also say, we're managing in the right way without any verification from a third party. So very similarly, is some of the questions that are coming in, and I see some coming in to everyone, some privately, is GCS providing this particular type of facility certification anywhere else in the world?
Yes, this process has commenced in the United States of America.
Yes. Good. So, and that is, what type of facility is that being done right now in the US?
At schools, it's been done at schools, from a group of schools. I don't, David is online.
I'm not seeing David.
Okay.
Right. So yeah, one of the other questions was, is it only for religious institutions and schools, or could it also be done for offices?
Yes, it's open to all public facilities. Anyone who wants to provide assurance to the public that they are following all of the protocols and they are prepared, they can apply to us to do that process.
Right here, does it also cover the public sector? Could the public sector also be participating?
Yes, it also covers the public sector.
All right, and then I have, what other services does GCS provide?
GCS is a ISO accredited certification body, so we provide certification to ISO management system standards, and also we provide training on ISO management system standards in terms of the introductory requirements on the standard, internal auditor training, lead auditor training, and also training on implementation requirements.
I see that there's another question here as well that is regarding contact details. I know that you have that towards the end of the slide. See, Dylan is offline. Dylan, do you have a question?
I do, sir.
Please go ahead.
Can you hear me?
Yes.
Yes.
All right. I'd just like to know, for the sake of the purpose of the media, is this program a recommended program by government? And could the presenter say if this program will be a sustaining program for the government?
It is not a recommended program by the government. As a certification body, an internationally recognized certification body, we have decided, just like how we would do the ISO certification for other entities to provide confidence, we have designed this program in-house to create confidence in terms of the COVID-19 and how we can ensure that our facilities are safe. So it's a proposal that came from us, a private and independent entity, and it is open to be utilized by public facilities, private facilities, all those who think that such a program will be beneficial to them.
All right, thank
you for the question, Dylan. And one of the key things to remember as well is that COVID is still fairly new, and I understand from the company in the US that the demand actually came from the schools. The schools actually wanted to have some level of assurance. And if you think about ISO 9001, Kandel, I know that there is a section in there that deals with the management of the facility. So part of what that I believe is going to be very useful is making sure that we have a system for managing our facilities. And in this case, this one is just very specific to COVID. I saw another question here as well. Can someone from the private sector apply? Example, hotels and restaurants?
Yes.
So I would suppose that anywhere that would have to accommodate groups or have to accommodate the public. And this certificate is also right. So I'm getting two questions here. How long is the certificate valid for?
12 months.
12 months.
It's renewable.
And it's renewable. Right, so it could be renewed as well. And then when you say certificate, is this the type of certificate that could be displayed at the facility or should be displayed at the facility?
Yes, it is. And also it can be verified. I'll go to the website with an example shortly and show you an example as to how we can verify this certificate.
All right. So Kandel, if you want to do that in the meantime.
Yes, I can do that.
And let me just check to see if we've answered all the questions.
You're seeing the screen?
I'm seeing the PowerPoint. So maybe stop sharing, go to the website, and then start sharing again, because I'm seeing the PowerPoint still.
Okay.
And to persons looking at this presentation on social media, feel free to leave a comment on the video. And I'm sure that GCS will be able to respond to any comments. And from my understanding is that just like ISO, this provides third-party assurance that the systems in place will safeguard yourself and the public.
You're not seeing me as yet?
No. So just share this. You'll have to go back to share this, pick the screen that you would like to display, and then click on share.
Oh, it's not coming up.
If you would like, I could pull it up and share it, and you can tell me the code maybe.
Yes.
Would you like to do that?
Yes, you can do that.
All right, so I'll pull it up here. You should be able to see my screen right now.
Yes.
And then we have the option here, view certificates,
Verify.
verify certificates. So I
Yes,
have
you
to,
click on verify certificate.
right,
And in the column there, you put in capital FHC
FHC,
C dash 2243. And then you click verify.
so everyone who does pass the certification is going to receive a certificate number that they could verify here. So this says company name, GCS Demo Academy. You have the address, and the standard is actually the facility conformance CDC health guidelines. So,
Yeah.
and then you have the certification number, the issue date, and until it's valid. So this is what's the purpose of being able to do this, Kandel?
Yes, you hear me?
Yes.
Yes, the purpose of this is to validate that you've been certified. So when you verify, like with any other ISO certification, this is extended to you. So when you validate, you put in the certificate number. So if you go to a facility and you see a certificate published, you can take that number and put it into our website and verify it. So you'll see the name, the address, and how long it's valid for. Because sometimes persons may want to take the shortcut and do a copy of a certificate or prepare a certificate that looks like ours. But if you put in that number, you will see who is the owner of that certificate. So it adds control to the process, which we think is important. The same thing as an international practice. When certifications are issued, if somebody say they're ISO 9001 certified, you could actually verify that they were indeed issued with a certificate. Yes.
Fantastic. So let me just ensure we have any other questions that have come in. Right, so we're getting a lot of thank yous. Thank you. Right. So people are very happy with the presentation as a good initiative as well to help us feel safer when we are in public spaces. Kandel, I would really like to thank you for taking the time out to share this very valuable information. And even for the organizations who may not get certified, I'm sure that they got some further guidance on what they can do to safeguard themselves and the public. For those organizations that really want to move forward, to have a third party come in and capture what they might have missed, because it's blindness, right? If you keep visiting your own location every single day, you might miss certain things, which is very different from when you have a second pair of eyes taking a look at it according to a specific standard. So for portions like that, if you're really looking to have a third party come in and verify that your facility is really up to standard, I would encourage you to contact Kandel. You have the contact information on the screen right now. Kandel, is there anything final you would like to share?
I'd just like to thank everyone for their participation. Thank you for your comments, your questions. And we're hoping that you will spread the word about this process to your different stakeholders so that we can embark on it. Remember, Guyana is moving to the developed state with the oil and gas sector, and we must operate, to that higher level and provide that higher level of expectations and confidence to the public and those around us. So I want to thank you for your participation, and I hope that you will be able to utilize this process, those of you who can, and also to share it with others so that they can learn more about it, so that we can be better prepared when the time comes for reopening of our public facilities. Because remember, we do not know when the COVID will go, and we're seeing the trends in Guyana. We're seeing increases, weekly. And we do not know what will happen when our schools open or when we decide to open, because I'm sure you will agree with me that we will not be closed forever. We will have to open at some point, but we can use this time to better prepare ourselves and our facilities so that we can go out there providing greater confidence to the public and also to ourselves. So thank you again and have a great rest of the day.
Thank you very much, Kandel. And to everyone watching on Zoom, thank you for joining us. For those of you on social media, we thank you also for your attention. And we would encourage you as well to share this video with any organization that you believe can benefit from these services, because the key thing that we really want to ensure is that the public is safe as the reopenings start. And it's something that I think that will really safeguard a lot of lives. Thank you very much, and I look forward to talking to you again soon, Kandel, and keep up the great work.
And thank you, Dr. Durga, for always being a great host.
Thank you.
Thank you for the support.
Welcome.
Bye.